South Korea will be rolling out its first vaccines later this month. The authorities still haven't decided whether the one made by AstraZeneca is effective for senior citizens. A second panel of experts have reviewed the question, but says it needs more information to draw a conclusion. A third panel will consider the question in the coming days, after which there should be a decision. Jang Tae-hyun tells us more.
An independent panel, the Central Pharmaceutical Affairs Advisory Committee, announced that they're putting off the decision on whether AstraZeneca can be administered to elderly people, those over the age of 65. They said that it can be given to those over the age of 18, but for those over 65, more data is needed. It's the second panel in the country to evaluate this vaccine. For a fair evaluation of its safety and efficacy, South Korea's Ministry of Food and Drug Safety is getting reviews from 3 different expert groups. Earlier this week, the initial review conducted by the Verification Advisory Committee concluded that AstraZeneca can be given to those over the age of 65. The country has secured AstraZeneca's vaccine for 10 million people, and it will get shots for an additional 1.3 million people through the COVAX facility in the first half of the year. Among that number, shots for 300,000 people will be available by March, so some people in nursing hospitals and similar facilities will be able to get this vaccine by then. Meanwhile, South Korea saw a slight drop in the number of cases, with 370 recorded on Friday. Most of the cases were from the capital region. Health authorities are emphasizing that people need to follow the guidelines to stop the spread of the virus.
Except when eating or drinking at restaurants and cafes, wear face masks at all times. When eating, please refrain from talking. The coronavirus can spread in crowded, enclosed places where it's not often ventilated.
The country has been trying to lower the number through strict distancing measures, and as the caseload is slowly going down, they are discussing whether to ease the measures starting next week. But health authorities are concerned about a possible outbreak after the Lunar New Year holiday. The changes will be announced this weekend. Jang Tae-hyun, Arirang News.